Okay, today I'm going to teach you how to do the clamshell. So the clamshell is going to target your gluteus medius. You have three glute muscles, so that's in your butt. And the trend that I've noticed is a lot of people have really weak glute meats, and so that contributes to a lot of low back hip pain. And so one really good exercise to target that is the clamshell. And so now what I like to teach patients is it's not about big grandiose movements. It's about targeting and isolating the structures to help strengthen and move forward. And so if you can't identify or figure out what muscle you're trying to activate and strengthen, you're not going to really go anywhere. Okay, and so here's the trickiest part of this whole exercise. When you do this hip exercise, you want to make sure that you're nice and flat on the hip that's going to be on the ground. So I'm going to be laying on my left side, and so you know how there's that one spot here where it's kind of nice and flat? You're going to try and lay on that spot on the ground and make sure you're balanced. If you're not, you're going to find that if you're kind of tipping forwards or backwards, it's not going to set up, and so you won't be able to isolate and target for gluteus medius. Okay, so you're going to lay down, keep your body in a nice straight line, so you have an imaginary line through your spine, so your head, neck, your torso, all in a straight line, and then the bottom of your feet are going to be lined up with that imaginary line. Just make sure that the knees are going to be bent and brought forward. So simplest form of using levers, so you're going to have your knees bent for this whole exercise, and when you bring your legs closer to your chest, it's easier. When you have your legs straighter, so farther away, you're going to increase that the instability, and you're going to make it challenging and harder. So kind of just play around and see what works. There is no one set position and it should be it. No, try it out. I myself also sometimes have issues where I have to kind of shift around until I find the good spot. So not a big deal, just try your best, okay? So all we're gonna do is lay on our side. All right, okay, nice and flat on your side, okay? So this side here is gonna be nice and flat. You're gonna have your arm underneath your head just to help support. Everything is in a straight line. I shouldn't feel like I'm going to tip backwards or forwards, okay? And knees are gonna be stacked one on top of the other, same with your feet. And then again, bottom of your feet are gonna line up with your that imaginary line through your spine. Head is going to be, again, facing forward with everything else. Get a shimmy. And now, because I'm a lady, I am not going to give away the show. So all you're going to do is slightly pull your knees apart. This is a hinge, your feet are a hinge. You're only going to open up between the knees, just slightly, just like so. Okay? And so you want to be able, the reason I'm going to put my hand here, sorry, I forgot to mention that. So you want to keep your hand up here, just so you can feel the hip bone move, okay, so the femur. Now, we don't want it that it pops all the way out. We want it that we are controlling by only slightly lifting up. If I feel like I'm holding my leg too much, then try shifting forward just a bit, okay? And 1 sec. It's a little tricky, I didn't lie. All right. And so all you're going to do is just like so. Nope. It's a tough one. There we go. So I had to move my legs just slightly away from my body, but now I feel that, and it's sore. That's a downer. Okay. So you should feel like a cramping sensation in the back of your leg or in the back of your butt, and that's good. And so you're not going to hold the position upright. You're just going to keep just kind of lift up a little bit and down, okay? And like I said, you don't have to hold anything because it's going to work it. And so you should feel it all right back here, okay? And then if we want to do going to my hip circuit, all you're going to do is straighten out the legs. Keep your body nice and flat. You can place your top hand in front of you. Just make sure, again, nice and flat, and all you're going to do is lift your leg up. So we should be feeling that targeting the muscles here, so your hip abductors. So all you want to do is make sure you're feeling it here. If you don't, chances are you're not pointing, your thigh isn't in the right position. So you have to rotate So in order to rotate your thigh in the right position, you're just going to turn your foot downwards a bit, okay? And you don't need to point your toes or anything like that, okay? So if you're pointing up, you're not gonna feel anything. You want to point down. Okay, and then the last part for my circuit, all you're gonna do is bring the top leg up and over, and you're gonna still keep flat on your bottom leg, a hip, and place this foot flat, so the right foot's gonna be flat. You can place your right hand on top of the ground here, just for extra support. You might have to shift around your hips, just to make sure you're nice and flat, and you're gonna focus from this spot right here, your inner thigh, so your hip adductor, and all you're gonna do is lift up and down. If you're lifting up too high, that means you're tilted too far back. So, tilt forward, lift up, and down. Okay, and if you need to shift. So, those are doozies. They definitely work, and if you want to try and target hip and back pain, they're great, super easy, and simple to do. All right, good luck, guys.